Welcome to America's Heroes Group.
Thank you for joining America's Heroes Group Roundtable. We are globally connected with Kaiser Health News. Today is Saturday, November 5th, 2022. November is Military Family Appreciation and Alzheimer's Disease Awareness Month. Our host is Kelley. I'm your co-host today, Debra Denhart. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega, Scouts Honor Productions. And today we're going to be joined by panelist Julie Appleby with Kaiser Health News. Julie, thank you so much for being a guest today. Julie is a senior correspondent with Kaiser Health News, which is an editorially independent program of the Henry J. Kaiser Family Foundation. Julie, thanks so much for joining us today.
Great. Thanks for having me.
Now, we're going to be talking today about your article, Kaiser Health News article, Shopping for ACA Health Insurance. Here's what's new this year. And what a great article, Julie. It was amazing.
Well, thank you.
Yes.
Thank you.
Great information. It was just awesome. Now, I know you're a senior correspondent, and you also, let me just continue. You report on health insurance, healthcare treatments and costs, and policy affecting hospitals and other medical providers. Before joining KHN, Julie, you spent a decade covering the health industry and policy at USA Today. Pretty impressive.
Well, thank you. Yes, it's been fun.
That's great. Okay, now let's start with, the beginning. What is the Affordable Care Act, open enrollment period, and how long does it last?
Well, that's a really good question. Open enrollment is basically sort of like the window of time during which you can change your plan or join a new one or make adjustments to your current plan. And remember, this is the Affordable Care Act, and this is what people buy who don't get job-based insurance for the most part. So these are folks who are self-employed. Maybe they work for a company that doesn't offer health insurance coverage, or they're a student, that type of thing. So they go on these marketplaces and buy their own insurance. And right now is the annual open enrollment period. And it's basically the main time to sign up. Now, there's a few other times during the year. If you have you change your job or you lose your insurance or you get married, there's some special enrollment periods. But this is the main one for everybody. And it was kind of put in place because they didn't want people to wait until they got sick to enroll in coverage, because you need a kind of a nice mix of healthy and sick people to make insurance work. So they didn't want people to wait until they got sick. So they said, hey, there's one time a year when you can sign up. And this year, it happens to run from November 1st through January 15th. But if you want coverage that starts, January 1st, if you're on a calendar year, you need to sign up by December 15th in most states. So that's kind of what the open enrollment period is all about.
Okay, great. Now, who is eligible to get an ACA plan?
Yeah, that's a really good question, too. So who buys it? Like I said, people who don't get their coverage through their jobs, that kind of thing. So there's a few other requirements. You've got to live in the United States. You've got to be a U.S. citizen or a national, and you can't be incarcerated. So those are sort of like the main three eligibility criteria. Okay.
Now, who qualifies right now for a subsidy to help purchase the coverage?
There are a lot of subsidies to help folks buy coverage, and most people who buy an ACA plan get some kind of subsidy. So let's just kind of run through it a little bit. So to get a subsidy, you cannot have job or government insurance that's considered affordable. So if you have a job or if you have coverage like in the VA or TRICARE, you might not qualify for a subsidy, with one new exception that we can talk about later. But that said, most people who do buy an ACA plan get a subsidy, and those subsidies help offset the premium. And some people also get some additional subsidies to help them with things like the deductibles and copays. So subsidies, they got a boost. A year or two ago. Remember when the American Rescue Plan was passed by Congress during the COVID pandemic, the early days, and then signed by President Biden in March of 2021. And then this year, the Inflation Reduction Act, which Congress also passed and Biden signed, I think, in August, created these enhanced subsidies. So what does that mean? It It means that right now, people who earn up to 150% of the federal poverty level, and for an individual, that's about $20,385, and for a couple, it's about $27,465. So if you earn up to 150% of the federal poverty level, you can get an ACA plan with no monthly premium, essentially, because the subsidies fully offset it. So you can get a zero premium plan. After that, going up the income scale, there's a sliding scale subsidies for people who earn up to 400% of the federal poverty level. And those sliding scale subsidies they're based a little bit on income, and they're based on the cost of the plan, and they vary, but they offset part, or in some cases almost all, of the premium cost of a plan. Then after that, after 400% of the federal poverty level, which is about $73,000 for a couple. After that, there used to be this cliff. People would call it a cliff, where if you made like $1 more than that 400%, you would no longer get a subsidy. And that could be a real shock, because these plans, even though it's called the Affordable Care Act, they can come with some pretty hefty premiums. And if you don't get a subsidy, it can be a lot of money, particularly the older you get, because the Affordable Care Act allows insurers to charge older people more than younger people. There's a limit how much more they can charge them, but the older you get, because your healthcare costs are probably going to be higher. The older you get, the higher your premiums can be. So now, under these new enhanced rules that are in place until 2025, people over 400% of poverty might still get a subsidy, because they're only required to pay 8.5% of their household income towards the premiums before these subsidies kick in. So depending on how much your income is, you might still get a subsidy even at those levels.
So as far as having a job, previously I know some families received their coverage through their jobs, found they couldn't get the ACA subsidy. So you're saying that could be changed, right? Because you mentioned, that's one of the new things this year. That's what one of the things in the article spoke about, is that there's some new rules that went into effect. It was a rule recently finalized by the Treasury Department that kind of aims to address what people kind of call this family glitch. Mm-hmm. The family glitch, basically, and hang with me here, it's people with job-based insurance can't get a subsidy for the most part, right? We talked about that a little bit earlier. But if your job-based coverage at your work is considered unaffordable, you can get a subsidy. But there was a catch. Previously, before these rules, they would look at the cost at your employer for single coverage only for just the employee and base it off of that. So if that was considered affordable to you, then you wouldn't be able to get an ACA subsidy. But they didn't consider how much it would cost to add your family. And that can be a lot more, right? So they didn't consider that cost. It was not part of the calculation. So what happened was a lot of families couldn't afford it through their employer. But either they did, and it took a big chunk out of their paycheck to have that family coverage, or they went uninsured, but they couldn't go on the Affordable Care Act and get a subsidy. So that was kind of considered the family glitch. But now, starting next year, they're going to look not only at what it would cost at that workplace to just cover the employee, but how much that worker would have to pay out of pocket for their share of the premium cost to add their family members. And if that amount is more than 9.1% of their expected 2023 income, they could choose to go on the ACA and see if they can get a subsidized plan that might cost them less. Now, it might not save families money, but it might. So what the experts tell me is that families really need to look at this and weigh the costs. In some cases, the employee might stick with the job-based plan, and their family might go on the ACA and get coverage. But when you're looking at something like that, you got to think about, then you got 2 deductibles to meet a year, maybe, and this, that, and the other thing. So you've got to kind of do the math. But for people who do qualify, there was a Urban Institute study a while back that looked at this, and they thought that on average, families would save about $400 per person, per family member,
by signing up for this because they would be able to get the subsidies. But that's on average, and not every family would save. So that's something that's new this year is if you get coverage through your work, but you have to pay a lot out of pocket toward the premium, it might be worth looking at seeing whether or not you meet that 9.1% threshold, and if so, whether or not it might be less expensive for your family to get an ACA subsidized plan rather than sticking with what you have at work.
I think anyone would be looking into how to cut the costs, right? I mean, premiums for health insurance can be so crazy, right?
Right. Yeah, it's not inexpensive. It's not. Yeah.
Now, besides the premiums that we're talking about, what are the other costs in an ACA plan?
Well, yeah, you've got the premiums, and remember, premiums are going up a little bit this year, right? Because we've had inflation and that kind of thing. So just the premiums in the ACA plans are going up on average about 4%.
Wow.
So that sounds like bad news right off the top. But remember, most people get subsidies. So if you get a subsidy, you might see a premium increase, but the subsidies are also tied to the cost of sort of a benchmark plan. So as that benchmark plan starts to get more and more expensive, the subsidy goes up. So for a lot of people, the subsidy is going to go up, and it may offset all or part of the premium increase for next year. And again, the consumer advocates tell me that even if you're enrolled in a plan now, you should shop around, go on the website, and look and see what happens to the premium if you compare it to some other insurers, and you might save money by switching to a different insurer. Now, you got to make sure, the doctors and hospitals and such that you want are still in that new plan before you change, but you might want to just kind of compare across plans. And like you mentioned, premiums are not the only cost in a plan. You've got to look at the annual deductible, which is how much you pay before most of your coverage kicks in, right? And that can be a lot. In fact, I think I was looking at some statistics earlier, and the average plan the average bronze plan. They come in these different metal tiers, like bronze, silver, and gold, right? So the average bronze plan, which is the least expensive plan, premium-wise, on average had a more than $6,000 deductible, and the silver plan had a $4,500 deductible. Was a couple. That's a lot, right?
I'm sorry. Yes. I've seen the 6,000. I was going to mention that. So that's a lot. That's a huge deductible.
Yeah, but again, there's subsidies available. I think slightly more than half of the ACA marketplace has folks that qualify for additional help, and that additional help can lower those deductibles. I mean, by a lot. Many of them well below $1,000, and some are even less than $100 for some people. So, again, it's worth going on the website. And if you live in 33 states, including Illinois, that are part of the federal healthcare marketplace, that would be healthcare.gov. And then 17 states run their own marketplaces, and they're called different things in different states. Like California's is called Covered California, and so you need to find the website for that. But most of the states are in healthcare.gov, and you can go on there and put in your information, your zip code and that type of thing, and your family size and your income, and it'll show you the plans available in your area and also what subsidy you might get, and then you can compare some of these deductibles and copays across the various plans.
I'm sorry. Go ahead.
No, go ahead.
I was going to say, and they have to now. It's pretty common to see the comparisons, right? You can compare a lot of different plans.
Yeah, you can see all the different plans in the marketplace. That's why you want to make sure you're on the official healthcare.gov site or on your state marketplace, or talking to a broker or an assister or a navigator who's going to show you all the plans in your area. But you don't want to just see a few of them, so show you all the plans. And some places have quite a choice. But there's another new thing this year. ACA plans have always been required to cover kind of a wide range of services, and they have to all offer coverage for things like, emergency care or hospitalization, pregnancy, mental health and substance abuse disorder services, prescription drugs. I mean, they all have to cover these basic things, but they might vary in terms of what their deductibles are and their copays and how much you pay every time you go to the doctor, and are there some doctor visits that you can go to before you hit the deductible. So this year, they decided to also create standardized plans in the healthcare.gov in these 33 states these standardized plans are going to have the same deductibles and copays on the theory that as a shopper, it might make it a little easier to kind of compare one plan to another because they all have the same exact annual deductible, and they all have the same drug copay deductible, or this, that, and the other thing. They all are the same. And I went on the other day just to see how this works. And you need to go on and you need to click the plans. You need to go on the filters button, and then they're calling them easy pricing.
Oh, okay.
So look for something called easy pricing, and then those all come up, and those are the standard plans. And you can just filter and say, hey, I just want to look at those because I know, from insurer X and Y and Z, they're all going to have the same deductibles and stuff. So I can see how much my monthly cost will be for the same kind of plan. And that's new this year.
That's great. Because education is power, right? If you don't know,
right,
how are you going to make the right decision? It has to be educated, right?
Right, right.
Now, for people, I know we talked about ACA enrollment. For people who are getting their health coverage through, say, their jobs, is this also open enrollment for them as well?
Yeah, this is the time of year your HR department, sends out all those forms and stuff and all the brochures and tells you, hey, you got to pick a plan for next year. Now, some employers only have one plan, so there's not a lot of choice, right? But other employers, there might be a choice of, different kinds of HMOs or PPOs or different deductibles, that kind of thing. So this is the time of year that people can select that. And, just like everybody else, the employer plans are seeing costs go up. This year, meaning 2022, the average cost of a plan offered by a company was nearly $8,000, and that's just for worker only. That's just the one individual, right? $8,000 a year, and out of that, the worker on average paid about $1,100 of that premium, and that's just the premium. That's based on a survey of employers around the country, and that's for single coverage. Now, for a family plan, and this blows my mind, the average cost for a family plan, the average amount that an employer pays is more than $22,000. And of that, the worker on average pays nearly $8,000 out of their own pocket just for the premium, right? Then you've got the deductibles and stuff on top of that. So,
wow.
So those are really expensive, and employers, there's probably going to be some inflation in those costs for next year as well, and the big question is, your employer going to pass that along to you? And if so, how? Will it be, hey, you got to pay some more every month towards your premium? Are they going to raise deductibles? Or maybe they're going to decide not to do anything at all, right? Because we're in a pretty tight job market right now, and health benefits are one of the ways that employers really like to attract and keep good workers, so they might not want to make them angry and raise costs right now. But that's what employers are all kind of looking at right now and rolling those out. And so, I think folks are probably looking at that at their jobs right now.
Okay, thank you for that. Now, the ACA was opposed by Republicans, but all attempts to repeal it failed. Is that effort over?
Yeah, it seems like it in a way. It seems like, we heard a lot about repeal and replace a few years ago. We haven't heard a whole lot now. It's almost like it's become normalized. This year, I think there were 14.5 million people who bought an ACA plan. It was the highest ever, partly because of these enhanced subsidies we talked about earlier. So there's an awful lot of people who buy their coverage. We haven't heard a whole lot about replacing it, except, again, last week we did hear out of Arizona, the Republican candidate for governor, Kari Lake, said she wanted to see it repealed and replaced with something which she didn't specify what, but she seems to be about the only person right now who's kind of campaigning on that issue.
Okay. Now, along the lines of that, what about court challenges in the ACA? Are any still pending right now?
Yeah, we've seen a few, right? So they've gone all the way to the Supreme Court. Every one of them so far has been knocked down, but there is one pending, actually out of the same court in Texas where we saw some of these others start. There's a case that looks at a piece of the Affordable Care Act, and it's the piece that many people are familiar with. Like, when you go in for, a mammogram or a colonoscopy or certain kinds of other screenings, you don't pay anything. It's for preventive care. You don't pay a copay. There's no deductible. You just basically get it for free. That is part of the Affordable Care Act. But U.S. District Judge Reed O'Connor, back in September, he said that one of the ways the government decides what's on that list, these treatments and screening tests and vaccines and other types of things, one of the ways the government chooses those that'll be covered without any kind of cost sharing by the patient, he declared unconstitutional. Ultimately, that might mean some patients are going to have to start paying their share of the cost of like cancer screenings or part of the cost of drugs that prevent the transmission of HIV and that kind of thing. But right now, his ruling only applies to the people who brought the lawsuit. So for now, that kind of cost sharing is still in these plans for next year. Most of the experts I've spoken to think that the judge's ruling is certainly going to be appealed. It may go all the way to the Supreme Court. Who knows? But that process takes some time, and in the meantime, this coverage remains, and you can still go get your mammogram or that type of thing without paying anything toward it. And no decision is expected before at least the start of 2023, because he's having the folks who are involved with this lawsuit come back in early January to talk about kind of next steps. So I think the earliest we're going to hear is then, and that's pretty much the biggest case that's sort of out there pending right now. But another question I think people might have going into this year is because we've heard a lot about abortion services and abortion coverage in health plans and the Dobbs decision, right? So a lot of states are passing rules restricting abortion. What happens with your insurance plan really kind of depends where you live and what your coverage is. But let's just go back to the ACA because that's what we were talking about. So in ACA plans, already, even before the Dobbs ruling, 26 states restricted abortion coverage in ACA marketplace plans. But 7 states, opposite to that, require it as a benefit in both their ACA plans and, frankly, employer plans purchased from insurers. So there are 7 states that require it and 26 states that restrict it. So that's still also sort of, we'll have to see. And if you have any question, what your plan covers on any of these topics, really, you need to dig into the plan documents and try to check your documents, check on healthcare.gov, call the plan, ask what's covered and what's not covered, and you can find out that way.
That's great. Now, as far as coverage, I know some people probably might not have paid their premiums right from last year. Now, would that prevent them maybe from not be able to, get the ACA coverage they need?
Right. That in the past would have, but under, again, another change that was temporary, it's kind of related to COVID, they're going to give folks that, and also if you haven't reconciled any kind of subsidies you get with the IRS, because you have to show what your income was for the year if you got a subsidy and get re-enrolled and get that subsidy again. So both of those things are on hold for another year. So insurance plans need to sign you up. If you haven't paid your past premium, they've got to sign you up again and take you on. And also the IRS is going to continue to kind of look the other way if you haven't quite reconciled your previous year's subsidies with them. So that shouldn't be a problem for enrolling this year either.
That's great. And for those who want to change some of the ACA coverage, in their states, what do you recommend them to do?
Meaning changing if they want to switch plans or what?
I'm sorry. As far as like what the state will cover, is there anything individuals can do that you've learned through your research that we can do? Like say, they want the abortion part to be, part of the plan, or they want certain coverage to, things like that. Would you suggest their congressman or senators?
Well, I think they'd have to work with each state legislature to see what they're going to cover, and that can be a really tricky issue. But yeah, people could ask their state lawmakers to do that. Each state, it gets complicated. Each state picks a benchmark plan, and it's usually based on some kind of employer plan for what their state's going to cover in the ACA that's offered in their state. So it's sort of depends what employers are offering in your state and which plan gets picked, but that's certainly something that if you've got some concerns about that, you should talk to your local state legislators about what are you doing about XYZ coverage, because I'm very interested in that, and find out what they say.
Oh, that's great. Now, did you find that COVID-19 had any impact on, what was seen in ACA, subsidies or anything like that? Did that have any impact on any of these things today?
The subsidies, maybe not so much. I think what we're seeing is, back early in the pandemic, a lot of people didn't go to the doctor, right? We didn't want to go out of the house. We didn't want to go in a doctor's office. So a lot of people didn't go in. So for a while, insurers were bringing in premiums but not spending very much of that premium on actual medical care because people weren't going in. That has changed. People are going back in now. Sometimes they're going back in sicker than they would have been because they did put off some cancer screenings or this or that or treatment, and now they might be sicker, so the costs are going up. And I think that's partly what we're seeing reflected in some of the premiums going up. But I think we're going to see more of that actually in the following year because, and also the current inflation of just everything, right? So I think we might be seeing rising premiums for a couple of years now just based on that. But that had a big impact for a while. For a while, insurers were not spending very much money on actual medical care because people weren't going in, but that's rebounded, and people now are going back in, and sometimes, unfortunately, they're not in very good shape, and so that they're having to have more care.
Great. Thank you so much, Julie. Now we have about a minute left. Do you have any final thoughts for our listeners?
Yeah, people should definitely just shop around, look at the plan you've got now. Maybe you really like it. Maybe you want to stay with it. See what else is available. Just make sure that the doctors and hospitals that you want to see are in your new plan, in their network. It's very important to stay in network with a lot of these plans. So that would be a phone call to make or something to check before you switch plans, just to make sure. And again, there's help out there. The Biden administration did fund these groups called Assisters and Navigators that can help people kind of wade through the complexity of this and help you get coverage. And you can find numbers and lists of those on healthcare.gov and also on your state programs. And there's a number of state groups that are trying to help people sign up for coverage as well.
Well, thank you so much, Julie Appleby, for being our panelist today and our partner, Kaiser Health News. Stay tuned with America's Heroes Group. We'll be right back.